Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, doctor. What are the different types of seizures and do they affect people differently?
Yeah, there are different types of seizures. They depend on the unusual activity that starts in the brain and how much of the brain is involved. Generally, seizure is classified as either the generalized seizure or focal, also called partials. Generalized seizure happens when it involves the seizure activity, the seizing activity that goes on in the brain when it involves the entire brain, while focal seizures start in some specific area of the brain.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Not always there is a known cause that causes epilepsy. For in fact, the number of amount of patients that we see in our chambers and clinic, about half of the adults with epilepsy, we may not find any specific cause. There are n number of causes, but in some patients, we do not find any proper cause, etiology that we call. For the other patients that commonly, those patients do have seizures or epilepsy, that includes head injuries, any infections in the brain, any form of tumors in the brain, and some metabolic abnormality. In any people who are over the age of 65, classically you will find stroke, Alzheimer's. They also, certain times, they also lead to epilepsy. Genetics do definitely play a role, and in kids, in specifically in the infants in the neonatal age group and the infant age group, the pediatric age group, we might find seizures after some episodes of fever. Those are totally physiological, that just can be managed by treating the fever. So no need to worry about that.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So signs and symptoms, basically for epilepsy, I'll tell you, they vary a lot. They vary a lot. But some common signs I'll elaborate, such as during seizure, any convulsion or jerking movement, that is called tonic-clonic movement, losing consciousness or staring off into space, confusion, even sudden fear or a strange feeling from inside. They may shake in just one part of their body, and that gradually takes on to the other parts of the body too. Like shaking of the right arm started, then it gradually moves on to the entire, all the four limbs, both the upper limb and the lower limb. If someone you know has these kind of symptoms more than once, it's a good, definitely a good idea to consult a doctor.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yeah, unfortunately, in our social status and social setup, we have often misunderstood rather, epilepsy for a long, long period. Historically, people never realized that epilepsy is a neurological condition. There was always n number of myths surrounding this, and why basically the seizing activity when the patient seizes, that is a frightening thing to see. So people may react with fear and even avoidance, and that led to the stigma.
How does this stigma affect people with epilepsy?
So stigma affects people with epilepsy, regrettably, that is true. But individuals with epilepsy often face negative attitudes and discrimination from others. This is a part of the social norm that happens. These negative attitudes are reflected in the reluctance to marry epileptic patients, their unwillingness to employ them, aversion to being in the same vicinity as them, and even discouragement of their children from playing with children who have epilepsy. Research has shown that stigma can increase the frequency of seizures because stress is a common trigger. And that is why communities need to be informed and supportive. They need to be supportive.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Triggers
Yes.
in many form, they are there that can incite a person to have seizures, like missing sleep, any very high amount of stress, any flashing light, sudden onset. If flashing lights, when you drive, flashing light from the opposite side may incite seizures, any fever or illness, and most importantly, who are already on the medications, anti-epileptic medications, if they miss their dose, that may trigger seizing activity. In fact, uh, even in women, the hormonal changes that happen during their menstrual life cycle also is a common factor. So any seizure or epileptic patient should maintain their seizure diary that could easily inform the physician or the consulting doctor that what exactly were the trigger things that made them incited them to have the seizures.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
Lifestyle tips: there are several healthy habits that can reduce the risk of seizures. It should always be known that a healthy lifestyle is an important point to maintain uh, a normal healthy life and reduce the frequency of seizures. I personally always encourage getting enough amount of sleep, as fatigue is a major trigger. Eating regular balanced meals and staying active can also help. Physical activity is generally safe for people with epilepsy. It should be it should not be a type of concern. Managing stress is equally important. That could mean that practice relaxation techniques, talking to a counselor, or joining support groups that will help.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Of course, at home, it's wise to clear away things that could cause falls, like cords or clutter, and to pad sharp corners on the tables. In the kitchen, use non breakable dishes and consider using the microwave when alone rather than using the stove. Also, placing soft carpeting can help reduce injury risk if someone does fall during a seizure. These precautions are very simple, but they make a big difference in the management and the further course of actions.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Definitely. Just remember, with the right kind of treatment, many people with epilepsy can manage their condition well and lead full healthy life. Being aware of triggers, practicing healthy habits, having support, they do make a big difference. And remember, you're not alone. There is a community of support out there. Two other things I'll definitely try to discuss. A patient who is a known epileptic should not drive alone. They should not drive at all. Even if they had to drive, they should not drive alone first. And they should avoid swimming.
Thank you, doctor. And thank you to our listeners. Until next time, take care and stay informed.